As connections are so slow, and that's why I'm struggling to connect to some issues that let's see. Let's see. The connection today is letting me down, man. I want to talk about cholera and these connections. The internet don't want me to talk about cholera. Cholera is a bad thing. Cholera is a bad thing. So let's talk about cholera. Let's talk about cholera. Let's get to know what cholera is. What is cholera? Fecal oral. What do we mean when we are talking about fecal oral complications? Fecal is fecal. Fecal is what you go to the loo to pass after you digested your food, after everything is okay, and now you want to be relieved. You go to the loo, and now a minute, my guys, a minute, my guys. Leave, 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 leave. Benjamin is here. Benjamin is here. We get to we go here. Get here. Post here. I can post at my friend here. Post so that people can know. People can know I'm online now. Hey, Uncle, I was just sending you a link. I've come late, but it's okay. I've been up and down, yeah, and it's good. Now, today we want to talk. We introduced the topic yesterday about cholera. We introduced a topic yesterday about cholera, and we said it is a fecal oral complication. You understand when we talk about fecal oral complication? Meaning, fecal oral complications are diseases that come because when you're taking food, you do what? You take the bacteria, and then it starts disturbing your stomach. So when this time we are talking about gastroenteritis and gastric issues, and gastric issues cause a lot of problems. We have started by fecal oral complications. Fecal oral complications, you understand, are the diseases that are brought by food, what you eat and what you drink. Those are fecal oral complications. So we continue here by and say, wait, I'm setting this, please I get a good light, and say that whatever you eat can pass different type of problems to your stomach. And the main thing that we are talking about today is cholera. You remember we discussed about typhoid. And typhoid, we said it's a very bad situation when you take that salmonella typhi in food, drink, or something. So today we discuss cholera. What is cholera? Cholera is severe acute diarrhea caused by infection of the small intestine with a bacteria which is called Vibrio cholerae. The main transmission is through contaminated water or food. When you drink water that is having this Vibrio cholerae, or when you take food that has this thing called Vibrio cholerae, you start having complications. And these complications are the ones that makes you to die or be very sick when you are having these problems of digestive system. You see, so this the bacteria that transmits cholera is called Vibrio cholerae, and it's a bad bacteria. You see, cholera is still a public health concern in many parts of Kenya and developing regions because of sanitation. Sanitation, we mean when we talk about sanitation, we are talking about some things called drainages, water, where you get your water that you are cooking with. That is called sanitation. A minute, sorry, something is really giving me heck here. this thing here. Yes, but now it's okay. Now that is what we call sanitation. Good food, water that is not contaminated. We will talk about it. Now the cause organism we have talked about it. The disease is caused by it's a gram-negative bacteria, Vibrio cholerae. What is a gram-negative bacteria? Because people think that every antibiotic you take can treat any it can take any bacteria. No, when we are talking about gram-negative bacteria, we are talking about bacteria that they don't have a cell wall. You see, those bacteria, they can be killed by an antibiotic. There is a process called gram staining that we realize that this type of bacteria does not have, it doesn't retain that crystal in the cell, in the walls, in the skin. Let me use a skin for layman. You get it? So that is what we call a gram negative. So many people don't know. Antibiotics are different and they treat different things. Aaronic, uh, our Aaronic priest, why am my teeth only getting holes inside? Aaronic priest is asking me, why are my teeth only getting holes inside? Aaronic, welcome to the channel. There is a bacteria called dental caries. Dental caries, when you eat and you don't brush your teeth. Aaronic, I think you are listening so clearly. There is something called plague that stays in your enamel, the white part of your teeth. So the bacteria comes and houses itself there. So when it houses itself there, it starts eating you from inside, because inside your teeth there is something called pap. We'll talk about dental caries. I think you have subscribed, and you will follow up, because when you subscribe and that topic comes up, you will get a notification that this is the topic that is going on. Aaronic, welcome to the platform. Please subscribe and like the video as we talk. Let's get the like. You can share to your friend and tell your friend that, hey, this is a platform where we discuss. It's only sideway of the teeth. Yes. Let me explain why before I continue. Let me explain why it is only sideways. Today I'm not using any software, so I will draw and show you my picture. So the teeth is like this. We use this one. The ventral, then it is like this. Remember, we are talking about sanitation. We are on cholera, but I'm answering Aaronic priest. Aaronic priest. I'm answering Aaronic priest. So this is your teeth. Aaronic priest, this is your teeth. This is your teeth. So when you don't brush your teeth, here, this is the pulp, the gum that you have. So the bacteria comes here and start eating. It starts eating as it gets inside. So when it gets inside, it starts eating the pulp. This is the pulp. It is soft and cool. So it starts eating because there is nutrients in the pulp. Aaronic priest, look at this. Look at that. It starts eating the pulp because this is your tooth. You see how it is, and these are your gums. These are your gums. So it starts eating and it starts eating this enamel. This comes why? Because the dental enamel, you have not been brushing your teeth, or you have stayed along drinking water that has some fluorine that is destroying this enamel, and then you start having some piles of food, and it creates the bacteria to come. So Aaronic priest, it starts small, and then it gets inside where it destroys the enamel from inside because it's outside. You get it? So my friend, a minute. So now we are continuing. That is the the problem with that. But that's why when you go to a dentist, they wash, they remove the bud, the bad things inside the bad layer, and then they seal it so that the bacteria cannot get inside. But the most important thing you need is an antibiotic to kill the bacteria that are inside. Mostly they give a broad spectrum antibiotic like ampiclox, fluoxetine, or metronidazole to kill that bacteria. Don't just take a mouthwash, take a bacteria to kill that bacteria from inside. Yes, I think I've answered that correctly, but ironic priest, that is a topic that is coming about the dental health, and we will talk about it dearly and deeply. So subscribe, like the video, and share to your friends. Now we are continuing to the cholera. Cholera, we have talked about it's a gram-negative. I've explained what gram-negative bacteria is. How is it transmitted? Cholera spreads through fecal-oral route. I've always talked about what is fecal-oral. Fecal-oral route means what you eat and the dirt that you remove. So when the dirt that you remove contains bad things like you don't know how to dispose. I've gone to some areas whereby the latrines are so bad, the sanitation is not okay, and you can find that some piped water they pass through some latrines that are open. You see, if that latrine has Vibrio cholerae, they'll mix with water that people drink and cook with it. You get it? And when this happens, what happens? Problems come in. When problems come in, you get Vibrio cholerae and then you start diarrheaing. So we are talking about the mode of transmission. Cholera is transmitted through contaminated water. When this Vibrio cholerae gets to the contaminated water and you drink, poor sanitation and hygiene, very important. You don't clean your utensils well, you don't do things well before you. Raw or undercooked seafood. You see, seafoods, they carry this cholera thing. Uh, they carry the out of topic. Yes, ask. You see, Mercy Grace, please just ask. You see, Ironic Prince has asked a question about the tooth and I've answered. So don't feel shy to ask a topic that is out of here, of this topic. Just ask any random question and I'll answer as we go on, Mercy Grace. Let's go on. Raw and undercooked seafood. Fish always carry the Vibrio cholerae bacteria. That's why it is the main reason why most people that live within fishing grounds, they can get cholera easily because fish carries that bacteria. Sometimes when you undercook the fish, eh, the bacteria does not die, you get it. When the bacteria does not die, you do what? You get it. Food handled by infected person. It reminds me of a story of typhoid. I will come live one day and tell people about the story of typhoid. If you are infected, you can pass the cholera to people by handling food in the wrong way. A tooth with no cavity but starts to turn reddish or pink for kid. What causes it, and can it be alarming? No, it can be alarming at times. It depends with why. Let me just a minute. It depends with why. This is for just a minute. You see, it depends with why the tooth is changing color. Some children take some things that make the tooth turn brown, black, dark yellow. You see, because of the change. You see, this is enamel, and then you bring another compound that has magnesium. They react, they change color. Let me ask. You're saying the tooth is no cavity but turns reddish or pink for a kid. What causes? Let me ask. Does the kid complain of toothache? Because sometimes it can be a sign of tooth decay. Because pulp, if there is a toothache, there is pain, it means that is pulp decay inside the what I've drawn. This one, This one inside here, the pulp is dying. But if there is no pain, it means that there is something that this child eats, and then it turns the color of the teeth. You see, some people that live around Lake Naivasha in Kenya, where there is high level of fluoride, their teeth are always reddish brown because of the water that has high fluoride. So that might be the cause. If there is no pain, just know there is this child is being exposed to something, or the child doesn't have some nutrients in the body that will help this child to be okay. Now, tell me if the child has pain, please, Mercy Grace, as you continue. Does the child has pain? And you see, there are some things that can change your color of your teeth. Food like coffee, tobacco, tea, red wine, poor oral hygiene, some medication. If you've given your child medication that has something called tetracycline, it can change the color of the teeth. There is excess fluoride that I've said from the people like living around Naivasha. The waters there have excess fluoride. Trauma of the teeth sometimes can cause. So tell me about all those things that I've said. What do you think this child is suffering from? And Mercy Grace, tell me if the child complains of toothache, so that I can be on point on what I'm saying about the teeth. Now we continue. We have said that we continue as we talk. Just answer me those questions. I'll intervene. Contamination, food, raw food, undercooked food, sanitation. Cholera is all about sanitation. Cholera is all about sanitation. We continue. There are some places that people have high risk of cholera. High risk of cholera, like refugee camps, flooded areas, because when floods are there, you see water gets into latrines and it comes out spreading the bacteria all over. You see, the mutuas are in the house. Welcome. And now people that have channels, please, when you visit my channel and we are talking and chatting, please link, just paste your channel on there. Let's paste the channel as we talk, because I don't have an admin and I cannot do it as I talk. Just paste your channel. We follow people will to follow the link here, please. The Mutuas, Mercy Grace, Jamaican Uncle is here. Please paste your channels on the chat, please. Yes, we continue. It's flooded area, overcrowded settlement, places with poor sewage systems. Places with poor sewage systems is a big deal. A person ingesting Vibrio cholerae, you see, it starts by you taking food. Now I'm talking how it comes out. Yes, welcome the Mutuas. This is how it starts. You take food that is contaminated with Vibrio cholerae. The bacteria reaches the small intestine. They produce a toxin of cholera. Now, the toxin in the intestine cell releases a large amount of chloride and water. You see, large amount of chloride and water, massive fluid loss, because in your stomach there is something called CAMP, which makes you to retain fluid and absorb fluids. You see, but if you don't have it as it needed, what will happen? You will start losing water. You see, you will start losing water and nutrients by diarrhea, because if you interfere with that process and the enzymes that are called CAMP, now you will not retain the sodium that you need in your stomach. You will not. Mercy Grace, I'm waiting for you to answer me. You will not retain. So what happens? You start diarrheaing because you cannot absorb more water. Treatment of cholera is always on. We do rehydration. To avoid that, we give you fluids, because what kills you is the diarrhea. In the in the intestine, remain structural normal but lose large amount of. You see, it has interfered with the enzymes that are normal in your body. So your intestines are normal, but you cannot absorb fluids. So you keep on diarrheaing and diarrheaing. This is the most important part of cholera. The physiology, the how you it makes you diarrhea is what kills you, but your intestines are good. They are not destroyed. You get it? They are not destroyed. So we continue and say there are some signs and symptoms that will note that this person has cholera. Eh? Symptoms usually appear 12 hours to 5 days of infection, or after 6 hours you can start. If you no pain at all, doctor. Mercy Grace, where do you stay? Please, I know around Mwea. It may be normal according to what I've how old is the child? How old is the child? It may be normal according to what I've said, but check how old is the child and the exposure to some fluids. And maybe you can find that in your family, this is a problem that is usually there. So it depends with the factors that I've said. With no pain, it means the teeth inside has not been destroyed. It means that the teeth inside has not been destroyed. So what happens is what is you do what you sorry wait kidogo tu kidogo. What happens is this, if there is no pain, you check the environment, you check the genetic line. Is there anyone with the same teeth? You get it? Or if there is no, if this child is under 5 years and is not removed all the teeth, you wait until the teeth are out, so that when the other ones come out, you can do what? You can know the problem, if it is the fluid food or exposure to something, because people are different, and when they are exposed to some different things, every problem comes out clearly. So you wait if the child is under 5, wait if the child is under, but if this child is over 5 years and you see that it's continuing to turn color and being destroyed, visit a dentist to find out the real cause, because you have seen we have so many causes, to find out the real cause. So we continue here by saying, so I think Mercy Grace, we are clear about that. This child is under 5 years, you wait until other teeth are out. But if this child is over 5 years and 5, 6, 7, 8 years, visit a dentist. Let the dentist know what to do, because many causes can make the ones that I've said, they can make your teeth to change color. Now, we continue by saying main symptoms of cholera. I think I've answered well, but if you still have a question, please just ask. The main symptoms of cholera are profuse diarrhea. It is called rice water color. If you look at it, it is like rice water color. Vomiting, and then you lose energy, leg cramping, and severe thirst. Because when you are having massive diarrhea, what happens? You have severe thirst. Signs and symptoms of dehydration is signs and symptoms of dehydration, like you can have dry mouth, you can have sunken eyes for a person who has diarrhea. These are the signs and symptoms of dehydration. Weak pulse, when you check the pulse, mostly we check here, you find it is really weak. Rapid heart beating, because it is compensating on, because the brain needs oxygen, and you don't have enough fluid in your body, so you have rapid heart beating. Reduced urine. Now if you are diarrhea and you are not retaining your fluids, what will you do? You will have no urine. So people with cholera, they diarrhea a lot and they don't urinate, because they don't have anything to urinate. We continue and say, there are sometimes a person can get into shock when this person is having cholera. If this person is having cholera, shock may come. We call it hypovolemic, because you have diarrhea, the volume in your body of fluid is low. You get shock. And if you get shock and the kidney is not doing its work because there is no volume, what do you get? The kidney fails. There is amount of volume in your body that is needed to help your kidney continue functioning. So if it is low for long, you will get kidney failure. Please We're talking, like the video, share it. Let's talk. Let's make the people know that we talk about health matters here and help each other. So, Mercy Grace, if you have a question, let's ask. Let continue asking. Don't be shy. Just ask out of topic. Death within hours is if untreated, because you are losing a lot of fluids. When vibrio cholerae gets into you, you are losing a lot of fluids, and the kidney may shut down. If the kidney may shut down, what happens again? Death, if you are not treated. So when you go to hospital, what happens is you get a lot of rehydrations so that you get the volume going on. Mercy, Doreen Small in the house, welcome Doreen Small. I'm not seeing people pasting their channels. Please, if you have a channel, paste your link here. Now we look at your channel too. Now we continue here after severe shock, which comes with shock, kidney failure, and death. We say types of cholera. We have asymptomatic. We have types of cholera which we have asymptomatic. Asymptomatic is whereby no symptom but bacteria are present. You don't have the symptoms but the bacteria are present. Severe cholera, the severe cholera, massive watery diarrhea, rapid dehydration, medical emergency. That is severe. You need immediate attention. But there is mild cholera whereby diarrhea is mild, it's not too much, similar to other infection. You think it's just a normal stomach problem. And you see, cholera may come by complications like severe dehydration, hypovolemic shock, kidney failures, electrolyte imbalance because of the kidney failure, and the last one always is death. Because if you are away from a hospital and you are not getting IV fluid, the cholera bacteria is not the one which kills you. What kills you is the dehydration and then kidney shutout. So we go usually keep you in hospital to keep you dehydrated. As you lose fluids, we keep your volume at par so that you cannot have a kidney shut and then you get death. So we take the sample to, when we want to know and be sure you have cholera, we take your sample to the laboratory, and when we take the sample to the laboratory, what do we look at? There is something called microscopy. We look at the what is in that stool. If we find it is Vibrio cholerae, we know this is cholera disturbing you. Rapid diagnostic test is in outbreak. Yesterday we talked about public health doctors. What public health doctors do, they this is where they come in, they separate people, they check about sanitation immediately, and they start acting immediately. You get it? Now, when it comes to treatment, I've said the main treating factor in cholera is dehydration. Oral salts like ORS, everyone knows ORS, rehydration salts, and then we have IV fluids, the one that we put on your line, and then we rehydrate you. So I've said what kills a person when you have cholera is, what kills a person is hypovolemic shock. Hypovolemic shock is the shock that comes after you have lost a lot of fluid. There is after we have given you the rehydration salts, we have given you the IV fluid, the intravenous through the veins and arteries. What we usually give you again is antibiotics to kill the Vibrio cholerae, the bacteria itself, so that you cannot. Thanks a lot for those loves. Thanks a lot for those loves. Like the video, my friends, share them. Share them. We continue getting to know each other. Now, and we give antibiotics like doxycycline, azithromycin, and ciprofloxacin, and we give you supplements. Supplements like zinc supplements. We give you zinc supplements to help your immunity. And then there is a very important part when it comes to cholera. This is a very important part. I want you to listen about this important part. This is a very important part when it comes to cholera. Prevention. Because if you prevent, we will not have problems. So what do we do? Boiling, drinking water, very important to kill the bacteria. chlorinated water. Good hygiene is very important, and good use of toilet so that you cannot spread the bacteria. No home is just here in Ruiru. Kid is 9 years. 9 years, please. 9 years. Visit that with that child to a dentist to get the real. There are so many causes. The ones that I've said, if including genetic factors, must regress. Visit a dentist as early as possible because this child has already removed the first uh, teeth, so that the dentist can know what to do. Now we continue. Food safety: eat well cooked food, avoid raw food, wash fruits and vegetables. Vaccination is very important to cholera outbreak. But there are some vaccinations that helps in cholera outbreak. And then we have the regions where cholera mostly is. The region where mostly cholera is, we have Africa, Asia, and Latin America because of overcrowding and congestion. Overcrowding and congestion, sanitation sometimes become a problem. So, why cholera is dangerous? A patient can lose up to 1 liter of fluids per hour. Imagine, per hour you have lost. So, which can lead to death within 12 to 24 hours if untreated. Because if you lose 1 liter of fluid per hour, it means your kidney will shut down. Hmm? However, if you properly rehydrate, this person may not die. You see, so we have talked about cholera. It was a short topic today, but at night, if we will have time, because today I'm in night shift and I can find some time. I can come at 10. We discuss about the pathogenesis and random questions as we discussed. So we have two questions for which I've answered correctly about the tooth. But for mercy grace, the child should visit a dentist because this child is above 9 years to get the root cause. There are several causes and I've named them to get the root cause of why. But sometimes you can find it's genetic, and when it comes to genetic, the dentist knows how to make it to make this teeth be okay. Hmm? And sometimes I've seen people washing with hydrogen peroxide. Try hydrogen peroxide. It may help remove the stains if there is no pain. You wash with hydrogen peroxide, it will help to remove the stains. And this can help to remove the stains if it is discoloration because of a substance that this child takes or drinks. But the main important thing is visit the dentist. So, people, today we don't have much time. I have to go, but I'll be back at the same time like yesterday to random questions. And if there is no question, please have a nice time. And next time when you come here and you have a channel, paste your channel on the chat, please. Paste the channel on the chat so that we can communicate and form a large family. So have a nice day, a nice evening until we meet the next time. Be blessed, everyone, to be here. I acknowledge your support in every way. Bye bye. See you.